It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Pillay-Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Aloha, happy Wednesday morning. I'm Yanji Denise here on Spotlight Hawaii, live on the digital platforms of the Honolulu Star-Advertiser. Thanks so much for joining us here on this first show of the year. Ryan is off today, but the show must go on, and we have a very important topic to talk about today. Joining us live from his office in Hilo is Dan Brinkman, CEO of Hilo Hospital. Dan, thanks for being here this morning.
Well, thanks for having me, G. I'm honored to be your first guest of the new year.
Yeah, off to a great start. I want to start with what's going on at your facility right now. Let's talk broad strokes. We, of course, come out of the holiday season, and we understand that throughout the last few months and really throughout the pandemic, tracking the numbers at your hospital and other health care facilities, you've been pretty busy.
Well, we've been very busy. COVID pandemic is, I think I'm safe to say, mostly ended, but honestly, we've just gotten busier and busier, and it's been something that I think the whole state has experienced, but we certainly have had quite the impact. It's had quite the impact on us. I haven't ever seen it this busy in my 15 years I've been with Hilo Medical Center.
Wow. So tell us sort of, your capacity and what your operation is like today and what it's been like over the last few months.
Well, today we have, we're 21 beds and we're completely full. I have a emergency certified unit, basically beds in an old facility that we own on our campus that we've had to turn into overflow beds. I have 21 patients in there. Those patients should be in, I would call, I have to be careful how I say that, but acute beds that were part of a hospital versus an older nursing home facility. They're safe, they're cared for, but they are sharing 4-2 room. This is like the way we did healthcare in the 70s, and I'm glad we have the space. I don't want to certainly be ungrateful because we have to keep and house our patients somewhere, but we absolutely have a need to expand our hospital. We've been on that journey here to raise awareness and hopefully have some success with improving our facilities.
Yeah, I want to talk about your proposed expansion in just a moment, but first tell us a little bit about the patients that you're seeing. I know that we are in a new phase of the pandemic, not quite out of it, but certainly not where we were. So given that, are these COVID patients, are these flu patients, RSV? What are you actually seeing? Who's coming to your facility?
That's a good question that you asked. The short answer, they're not COVID patients per se. We have a few. It's certainly still around. RSV has been around, flu. But what we're seeing, and we've seen this trend really over the last few years, but especially in the last year, is an increase in the overall illness or the acuity of the patients that come to us. There's a lot of speculation out there that for 2 or 3 years, especially our elderly population, put off care. They, I guess, foregoed regular visits or preventative care because of their concerns about getting COVID, and that perhaps has caught up with them. I also feel like that our state, and especially here on the Big Island, we're experiencing some of the aging of the population, this huge group of baby boomers that we've read about for years, but they are starting to get into their late 60s, early 70s, into the time where people have the most need for hospital care. And I think we're starting to see this wave that might be with us for the next 10 or 15 years of patients who need more and more hospital services, not outpatient services, but services where they require admission and care. And that trend has just steadily increased for us. And I think that's what we're living with this year. And it's not just a Hilo thing. I know that's happening at other hospitals on neighbor islands and on Oahu.
Yeah, and the overflow situation that you described, I mean, that's a good adaptation temporarily, but that's certainly not sustainable. And people on that island and throughout the state, we have what a lot of folks call a silver tsunami on the way, perhaps already hitting our shores. So tell us about what you are going to the ledge with this season. What are you hoping for this session, rather, to get to expand your facility?
So we're asking to basically add 36 acute beds, and that's kind of a medical term, but basically these are your beds that you would go into if you weren't critically ill. So 36 of those, and then 19 ICU beds. Our ICU is full. It's been full pretty much every day for the last several years. We definitely need a larger ICU. We want to add on to our existing facility. Our request is actually for the construction. We were very pleased and appreciative to get funding for the design of this a couple of years ago, have gone through that process, all the environmental studies and everything you have to do to get a project of this magnitude ready to go. And we are ready to go. We're just looking for construction funds. We have a project that's been designed, and when you say shovel ready, we meet the definition of that. And we're hopeful that we'll be successful this year.
Okay, let's take a look at what you guys are hoping to do. This is the expansion here. Tell us what you expect this to cost and what you think, what this upgrade would do for the community.
So this construction project has come in from our estimators in the ballpark of $50 million. It's an expansion onto the existing building, connects with our hospital on our third, second, and on the first floor, builds out over our existing parking lot. You can see in that rendering there the parking lot and the cars underneath. This is important for us because that keeps access to our facility very central. It's a pretty straightforward design. We certainly wanted to be thoughtful about expenditure and cost. It's not a cheap project, and we're well aware of that. But we think that it would meet the needs for the Big Island and for the East Hawaii community here for the next 15 to 20 years. I kind of give this story that this hospital was built in 1985. It was like our starter home, and mom and dad moves in, and then you start having kids, and then mom-in-law moves in, and father-in-law, and before long, you either have to add on or everybody's double bunking. And right now we're double bunking. And after 35 years, it would be really good, I think, to add on to our facility.
$50 million, as you noted, is not a small ask. What kind of initial reception are you getting to this? And tell us a little bit, we kind of think of this facility as something that benefits the citizens of, East Hawaii, but tell us why you think this is a good statewide investment.
Yeah, you bring up some really great points here, and I do believe, not just because I'm a supporter of the project, but because I truly think this will be a beneficial project for the healthcare of the state as a whole. The state is short of inpatient beds. The hospitals are full on all the islands. And traditionally, the neighbor islands transfer to Oahu, but Oahu doesn't have the capacity that they used to have. And honestly, the services on the neighbor islands are better where people can keep those services on the island. So if we're able to add, what's functionally 55 total beds to the count, that is our patients that can stay here on island and relieve some of the congestion that the state is feeling overall. So an add here, an add really anywhere in the state of acute hospital beds certainly is a benefit. I feel like, of course I'm an advocate, but we have been experiencing perhaps the worst of it here in East Hawaii, and we're ready to go. But I don't think that just this project is going to solve the long-term issue of a capacity for the state. I know the Hospital Association, the Healthcare Association for Hawaii has been looking at this, and I think this is also why, Governor Green and others have identified this as a need that really is about, the health of our state.
Mm-hmm. And of course, having a governor who served as a physician on the Big Island has to be somewhat helpful for your case. Tell us a little bit about any initial conversations that you've had with the governor and other lawmakers about how this proposal is being received.
You're absolutely correct. It's been certainly a gift for us to be able to work with a physician and then a senator and then obviously someone who's now our governor that's lived in our world and understands neighbor island healthcare. Dr. Green, Governor Green, has worked in our smaller critical access hospital facilities, but also at our larger facilities here, and he understands the distance and the challenges of neighbor island healthcare. But I think with being also a politician and an LG who understands the state's healthcare needs, he, I think, gets how they're connected and how help in this area on a neighbor island will also help the state, because I'm sure he has responsibility for the whole. So it's been certainly a big plus. We've gotten a very warm reception, and we're very gratified that the governor put this project in at the top of his list in his infrastructure priorities. And we're obviously very, very, very appreciative. Talking with our other senators and our legislators, honestly, I've taken a lot of time to educate them on these issues. Some of our representatives and senators who live obviously on the Big Island, they know about the need. I don't think that's something that is any surprise to them. But in fairness, we've had to also educate our Oahu legislators and others because obviously they have their own challenges in their own districts. So definitely been going around explaining why we think this would be something that would be good, not only for Big Island, but also really a good thing to support for the state.
Tell us about, this is shovel ready, as you noted. You've put in a lot of work already on this. In the absence of this kind of expansion, how much longer? I mean, obviously, you have to deal with what you have, but it does sound like it's untenable to have 4 patients to a room indefinitely to deal with all this spillover. And you did say that your ICU has been full, basically at capacity for quite some time. So tell us about, why the status quo won't work long term.
Well, and I think the word to use, untenable in the long term, is absolutely what the case is. We can manage the needs and keep people safe, but I don't think it's what we expect for our loved ones, our family, our friends, and our neighbors, to keep them and care for them basically in an environment that we could do a lot better with. I haven't had to spend more than a couple of nights in a hospital, but I definitely would prefer to not have to share my room. Semi-privates are a challenge. 4 to a room is, we're asking a lot of our patients. Again, we can keep them safe, we can treat them, we can do all the things for their health. But I think we could do better. And I think maybe the most important thing here is the situation won't gradually improve itself. If we don't do something, the problem is just going to gradually get worse because the silver tsunami, as you talk about, it's not going to go away. I think our population's needs are going to increase. And we've been planning and working on this for quite a few years, that something needs to be done. And I think we have a responsibility, if we see there's an issue, to have a plan and to execute on it. And we have a plan, and I'm very hopeful that we'll get the support we need to fix this issue.
One of the things that you mentioned was that in the past, the spillover, if you will, comes here to Oahu. But one of the things that was just, sort of brought to light was that medical flight, the life flight that went down. And that really exposed some of the challenges of having to shuttle patients from island to island. Do you think that having more beds in Hilo would help alleviate some of that pressure and perhaps not, have that need be so acute for those services?
The short answer is absolutely. I think it makes having more beds, more critical care beds, all make our system more resilient, and there's less dependency on transport. I think that, really in almost any health system, you always have a few things that have to be done at a tertiary or quaternary center where they do specialized things like brain surgeries or, or transplants or things that we really shouldn't be doing in more rural areas. But most of the things should be cared for in your community. And I think that having more beds, having more services here in the long run will make everyone less reliant on, honestly, a transfer system that's always prone to disruption because of the distance between islands, between the weather, and the fact that it's just dangerous to have to transport people in small craft. And I'm so glad that they do it, and my heart goes out to those folks who gave their lives doing it. But, we probably could do a little better.
Mm-hmm. Let's go back to that rendering for folks who are just joining us and perhaps didn't get a chance to see it. If this $50 million were to come through this legislative session, how soon could this facility, you did say it was shovel ready. I know you've done the EIS, environmental impact studies, and have the permits ready to go. How soon could this actually be up and running?
So our timeline, just to clarify, we're going to Hawaii County permitting here in January. It's a pretty complex project, so we figure roughly 9 months to a year for permitting. So that will get us to the end of 23. And then our hope is to start construction in spring of 24. It takes 2 years to build a project of this size. So we're looking, if everything goes well, in spring of 26, we would be able to move in. That's quite fast, even though it's, well, I don't know, most people in Hawaii, they know it takes quite a while to build something, but for us, that's blindingly fast. And so we're hopefully able to do that.
There are some questions about in our comments from our viewers this morning about personnel. I know that throughout the state, COVID really exposed some of the weaknesses that we have, challenges we have in terms of medical staffing and personnel. Would having this expanded facility, you would then need more workers. Can you tell us a little bit about those challenges and how you've been meeting the needs of having enough staff throughout this process, and what your hopes are with this new facility as well?
Yeah, just you bring up a really good point here, and that, depending on what hospital you're in, workforce may be more of an issue than capacity, or it may be both. And for us, it's probably capacity is number one, workforce is number two. As far as how we would staff this type of expansion, certainly the build out is needs for both right now and for the future. I would be very concerned if we moved into the building and filled it up completely. I think we will fill part of it right away, but there will be parts of it that we will grow into, because certainly when you build something like this, you want to have some capacity for growth, over the next 10 to 15 years. So from a staffing perspective, we would not have to staff every bed. But what we would be doing during that construction period is that we would be incrementally, for lack of a better word, I don't know if stockpiling is the right word, but we would be training and staffing up to be able, when we move into it, to have enough workers ready to go. We're very fortunate on Hawaii Island to have 2 schools of nursing, and the Governor Ige, and then also I know Governor Green has been very supportive of workforce initiatives and increasing the number of graduates that these schools can produce. So I'm hopeful all those pieces will line up. So when we're move in, we'll have enough physicians, nurses, aides, respiratory therapists to staff it properly. But it absolutely will take some legwork, really starting almost 2 years in advance.
Mm-hmm. You come at this at your position from such an interesting perspective, because I know that prior to your role now that you were in patient care. Tell us a little bit about sort of the challenges that you've seen over the last several years with COVID. We know that this has been a very difficult time for a lot of our medical workers, and sort of the status of things. I know that we've spoken to your staff over the last 2 years. At some points, it really seemed pretty dire with all of the COVID cases on Hawaii Island, and really the inability to transfer patients elsewhere. How has it been, sort of just reflecting, as your role as a leader there, and how do you feel about where things are now?
It's been certainly a trying 3 years really for healthcare providers. I'd worked as an ICU nurse for a number of years, and that intensity is something that you're drawn to. You're doing something that's really important in caring for people. But the intensity lasted quite a long time during the pandemic, and I think it also a lot of the uncertainty that went with it, the really strange environment where families weren't there and patients were isolated and staff were fearful not only for themselves but also, were they going to infect others? It was a very stressful period, and I think it took a toll on a number of our caregivers. I think that they have experienced burnout. We're seeing people move out of higher acuity and more intense areas and working in other, maybe less or more routine areas of healthcare, or even retiring. So all of this, has made it certainly a challenge. We're so thankful, though. This last year we brought on almost 45 new nurses whose enthusiasm and excitement about being able to get into a profession where they care for people and they really make a difference has been very refreshing. And I can just speak for our facility, but having those young folks around, I think, has probably buoyed a lot of the, maybe the attitudes or the, some of the feelings of our staff that had went through COVID, to see the next generation coming through and being very excited about, taking up the mantle. So it's been a mixed bag here, but I'm optimistic that we'll come through this pretty well.
Yeah, and so much of our conversation this morning has really been focused on the patient experience, but I would imagine that having a facility like the one that you're hoping to have with this $50 million ask would also really improve the quality of life for the people who work for you and who are caring for these patients. It's got to be tough for them as well, working with 4 in a room and having to sort of Tetris these folks in, if you will. And so tell us a little bit about what this would do, you think, for the quality of life for the providers as well.
I mean, that is a really astute observation, that it's this crowding, this capacity issues that we have, it is a burden on our caregivers. We're basically operating an acute nursing unit in a facility designed for long-term care. So the nursing support spaces aren't there. The flow's not there. We have had to MacGyver a lot of these spaces and just the work routines to make sure that it all works for the patients, and it makes the job much harder. And having been in the industry quite a while, the difference in facility for what's built in 1985 and what the standard is, what you really have to build in 2023 is amazingly different, because it really is designed to make it the optimal type of space for both caregivers and for the patients. And you're right, that would be building this would be a really big win for them as well.
Yeah, I mean, 1985 is certainly a long time ago, and you're saying no capital investments from then to now.
So, clarify, absolutely, we run a healthcare as a capital and infrastructure intensive operation. A lot of money has been put in keeping up our facilities. We've renovated rooms and we've added labs to our facility. But all of that has been, if I just did to go back to the analogy of your house, you have renovated it, you've kept it up, you've, replaced your bathroom, built a new kitchen, but it's still the same size facility. What hasn't been done is we haven't made an appreciable add to the square footage and the overall capacity of the facility. The state actually has been, especially in the last 5 or 6 years, has invested a lot in keeping their facilities maintained, and we've been very grateful for that. But we're talking about an add to the facility proper.
Okay. We're almost out of time, but I want to ask you sort of what's next as you head on this, the legislature is going to have their opening day and sort of what are the next steps for you?
Well, you could go and meet and advocate and do like what we're doing today and raise awareness. At the end of the day, though, it's up to our legislators and our governor, and I'm cautiously optimistic that they will kind of see things the way, with our priorities, but we're getting pretty close to the watch and wait time. I got the fingers crossed and say a prayer or two, and hopefully it'll work out.
Okay. Well, Dan Brinkman, thank you so much for being here this morning, for sharing what you're working on at Hilo Hospital. We really appreciate all the work that you and the staff there have done, of course, in trying to move this project forward and in taking care of so many people for the last 3 years and beyond. So thank you so much for joining us this morning.
Well, it's been great talking to you, and Happy New Year, Yunji.
Thank you so much. Aloha.
Aloha.
Very interesting to hear about what's happening on Hawaii Island. You heard there from the CEO of Hilo Hospital, Dan Brinkman, about the ask that they are making to the legislature this session. They're hoping for $50 million to expand their healthcare facility. They're doing the best with what they have, but you heard there they haven't made a significant expansion to the hospital. They have, of course, made upgrades and improvements as technology changes and whatnot, but they haven't done it since its inception in the mid-1980s, and they say they're really out of room. They're sort of MacGyvering, if you will, a existing facility to turn that into a place for acute care, but that's not sustainable for the long term. It makes it very difficult for patients and staff, and it's not optimal to, of course, to fly patients to Oahu to get care here at Queens and other hospitals, because, of course, you want to be treated in your hometown or at least as close as possible. So we'll be tracking this legislation, trying to see, this initiative rather, trying to see if perhaps they do have a friend on the fifth floor in Dr. Governor Josh Green. To see, of course, his ties to the Big Island as a physician. Will that help their cause? We expect so. $50 million is a significant investment, but you heard there Dan Brinkman really making the case that this is not just an investment for Hawaii Island, that this is a statewide investment and something that is desperately needed. Something also to keep in mind is just the geography of Hawaii Island, how big it is. Of course, they serve many patients in terms of population, but really what they're also covering is so much geographic area. So very interesting to hear from him. And also he said for the last few months, their ICU and their hospital have been pretty full. That is because of a mix of COVID, RSV, the flu, and also delayed patient care. So many of us have delayed our appointments during the pandemic, sort of trying to stay out of medical facilities unless it was an actual emergency. As a result, some of the illnesses and ailments have now reached, a higher level and need more treatment. And so that's why they're seeing the overflow there, not just at that hospital. Of course, we've talked to providers throughout the state and they are seeing the same thing. Good reminder, of course, to get your checkups if you have not already. We are going to continue our healthcare conversation on Friday with Dr. Tim Brown. We're going to be zeroing in on COVID. He, of course, an infectious disease expert at the East-West Center. We love to get his perspective. He always shares plenty of data and a lot of information. He's tracking what's happening on the East Coast right now with new variants, and also a lot of folks wondering what's happening in China with the zero COVID policy out the window there. What does it mean for variants, and what does it mean for us here in Hawaii? So we'll be talking with Dr. Tim Brown on Friday. We hope to see you right back here on Spotlight Hawaii. Until then, have a great week. Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.